The hepatitis C virus, or HCV, is a serious global health issue, not only in medical terms, but also in terms of the economic burden that is involved. In this short film, we're going to look at the economic burden of untreated hepatitis C, the indirect costs of hepatitis C, the growth of the clinical and economic impact, and how new treatments could improve the economic impact. Hepatitis C is a curable disease, but for patients infected with genotype 1 hepatitis C, the current treatment is successful in only about 40 to 50% of patients. Furthermore, untreated patients can develop serious liver complications, such as liver failure or liver cancer, and may even need a liver transplant. These severe conditions require other treatments or procedures. A study showed that these, when available, can cost more than $100,000 per patient when he or she is eligible for a liver transplant. Alongside the increasing healthcare costs, there are also indirect costs, such as decreased productivity due to inability to work and social costs. It is estimated that approximately 170 million people are infected with hepatitis C. In only 15% of the patients, the body will clear the virus. The others are at increased risk of developing liver cirrhosis and/or liver cancer. In fact, chronic hepatitis C complications are the most common reason for liver transplants in Europe. Over time, these costs will continue to rise. The hepatitis C virus was discovered in 1989, and it was only after 1992 that blood used for transfusion was screened to avoid the spread of the virus. When a person is infected with hepatitis C, it can take up to 20 years to develop liver cirrhosis or liver cancer. Therefore, people who were infected before 1992 may only be starting to feel the effects of the disease now or in the years to come. That means that during the next decade, the clinical and economic impact of chronic hepatitis C infection will increase significantly. For this reason, new, more effective hepatitis C treatment is seriously needed in order to address the financial implications currently associated with hepatitis C complications. A shorter, more effective treatment regimen could increase patient cure rates, reduce the need for transplants, and decrease the time during which patients incur related costs. This is how new treatments could improve the economic impact. With an expected rise in the occurrence of liver disease in those people that were infected 20 years ago, costs are going to increase drastically. Despite these financial implications, the hepatitis C health issue is still not a priority for most health authorities. Yet the long-term budget impact is going to be devastating if we don't act. So, what should we do? Firstly, it is important to make sure that people are aware of hepatitis C. A simple test will show if a person is infected. And once they know, they can discuss treatment with their doctor. This will prevent worse conditions in the future and could avoid further costs. Secondly, governments must take hepatitis C seriously and ensure that treatments are available and reimbursed. By doing so, higher costs in the future can be prevented. The European Liver Patients Association and the World Hepatitis Alliance are running awareness campaigns. By sharing the information contained in these animations, we can help them to achieve their goals.